Thank you, Mr. Chairman, and I appreciate the panelists here today. I wish you had a chance to actually answer questions instead of being lectured to, but because I guess this is a hearing. But in any event, look, I thank you for your work, and I know one thing. When I go back in my district and I talk to my employers, Obamacare's not working to them, and the frustration level is the highest I've ever seen. 8% costs per year in increase, but I also have questions about how we work this system to try to, so I'm going to ask four things, if you can address them as best you can. How do we start, if we're going to do some sort of a cap, and it's designed to make it more available to everyday people, not just to the benefit of the more wealthy members in that. So if we try to create caps, how do we keep the young, healthy employees inside that system? My second question is, if we're going to create a tax system that does some kind of a refundable tax credit, how do you deal with people who are families that don't currently have access to employer-sponsored programs? And what do you do with those who have an income level below, the 300%? A third question that my colleague talked to, how do you make consumers understand what to buy when they have a doctor tell them they're sick? First, they're sick. Hard time to make a lot of choices. Second, you don't understand what you're buying. You're being told, you gotta get this test. And then the last question, I'm throwing a lot at you if you have it. I'm anxious to hear us make, but how do you know an employer isn't going to keep the savings themselves and not pass it on in the form of wages that'll increase? A lot of questions, but if you can help me.
Those are all great questions. I think you've asked the right questions. So on the issue of whether the employer will keep the money or raise wages, the economic literature is overwhelming in indicating that there is an exact one-to-one correlation between, because it's overall compensation the employer thinks about, and it's a competitive market, right? If you want to retain those workers and not lose them to a competing firm, you got to pay them what the market's paying them. And so if healthcare costs go down, the cost of insuring your workers goes down, that gets returned to workers in the form of higher wages. So we can be optimistic about that. On the question of patient choice and how if you go to the doctor, you don't actually know, the doctor says you're sick, how do you deal with that? It's a classic problem in healthcare. There's a flip side to that, which is a lot of times you as a patient know a lot more about why you're sick and your family history and your background that the doctor does, who's just glancing at your chart, has forgotten a few things, your medical records are all over the place. So there's asymmetry in both directions. And the more the consumer's in charge of his own healthcare dollars, the more that doctor has an incentive to be really responsive to that patient and that patient's needs and that patient's unique medical history. And that's what our current system works against. And so, if I've missed anything that you've addressed, please.
Well, no, I asked two other questions. I want to know about young, healthy employees. How do you keep them in if we cap this system?
Right. So the issue of whether the young, healthy employees will withdraw from employer-based care and go off and shop on their own, you could see that to some degree, but you could also see a lot of people stay. And the reason why they would stay in the employer-based system is because of the economies of scale that come from a large employer or even a smaller employer purchasing health insurance in bulk for a group of its employees and having that negotiating power that comes with that versus being an individual shopping for coverage. So I think employers should retain some confidence that they have a lot to offer to that employee and they can provide other incentives to say, hey, we want you to stay in our risk pool. Here are some other things that we can offer you that if you bought insurance on your own, maybe you wouldn't get as good of a deal.
Okay, I wish we had time for follow-up questions, but I wanted to get my fundamental questions answered. And the last one was, how about a refundable tax credit for somebody that's not in an employment situation?
That's essential. So if you only have a non-refundable tax credit, then for people who don't have income tax liabilities, they can't get the financial assistance they need. So refundable tax credits are a very important part of equalizing the tax treatment of health care.
Mr. Antos, you got any response? Any thoughts on any of those issues?
Yeah, well, one other aspect has to do not just with wages, but also with people being able to keep their jobs. There are many margins of adjustment that employers face, and by giving more flexibility to the system, we'll not only have people with higher wages, but in some cases, when there's loose labor markets, when the labor markets are not doing well, the people will less likely to be laid off.
Thank you. Appreciate that.